Good morning and thank you for joining us. Welcome to session 2 in the six-part series of the Golden Thread Foundational Community Support. For those who are joining us once again, welcome back. And for those who are joining us for the first time, welcome. Great opportunity as always to train with the great folks of Washington. I think it's always an enterprising and mutually beneficial engagement. So look forward to, as usual, quite an engaging session today, and hope that you have some substantial takeaways. So welcome, and let's get right into it. And hopefully folks will join us along the way. Before we jump right into today's session, any concerns, questions, observations from our first session that folks want to share? I'd be certainly happy to provide some feedback or thoughts before we move ahead. And thank those folks who have introduced themselves in the chat and shared where they work, and that is just wonderful. All right, so let's get to it. Once again, today's session is going to be focused on the assessment process and prioritizing areas of need, which is obviously a critical part of the continuum of care, and certainly one that really speaks to your role and responsibility in promoting and facilitating the desired change in the pursuit of the goals of the people that you serve. So it's certainly a significant element where your expertise, knowledge, and your confidence and competence really steps into that mode. So just hope that today's session lends some significant benefit to that. So welcome, and today's webinar is hosted by DBHR through the Washington State Healthcare Authority. Once again, I think I mentioned earlier that this is an interactive training session, and we encourage you to kind of share your thoughts and ideas. And to remind you that the slides, as well as the link to the recording of this webinar, will be emailed to you subsequently. So look out for that. That should be made available to you some point soon. So our usual housekeeping, certainly you have the opportunity to engage via the chat. You can unmute and provide us with some comments and feedback. If you choose to have your video on, we ask that you respectfully maintain professional background, and please use the chat as much as possible, particularly to facilitate and expedite the engagements. We want to make sure that we're getting as much from you as possible. This is a recorded session, and once again, the recording will be sent to you subsequently. So, to give an overview of those, particularly for those who are relatively new to meeting with us for the first time, this is a six-part series, and last Thursday, we commenced with the introduction to the Golden Thread and psychiatric rehabilitation. We'll do a brief review of that today as well. Today's session is going to be focused on the assessment process and prioritizing areas of need. And that will transition next week and the following weeks through the individualized service plan, the components in goal development, applying the SMART framework to goal development, and how we develop and implement interventions and providing documentation at the end of it. We all know that at the end of the day, if it's not written, it's not done. So just as significant as the engagement process is the documentation at the end of it all. So That's important for us to certainly be reminded of. All right. So with that in mind, I am, for those who are new, my name is Earl Leach, and I'm a senior training and consultation specialist here with Rutgers University School of Health Professions. These 6 sessions will be facilitated by myself and my colleague, Emily Bands and Crystal Socia, who was present last week, and Emily is providing technical support for us today. So we're in good hands. So let's do a quick and a brief review of session one. So as you may have recalled, if you've been here, or for those who are relatively new, session one was really taking a conscientious look, a comprehensive look, as a matter of fact, the golden thread of foundational community supports, from engagement through the process of developing goals and interventions, and how those elements of the service continuum really feeds back to the assessment and consistently through the service plan and all the other elements that actually fed the service plan. So it's an important aspect of it to know that this is a loop, hence the word golden thread, that really weaves its way throughout the entire process of providing services. So when we speak of the golden thread, we're referring to what is certainly a Medicaid requirement, and it reflects the best practices for psychiatric rehabilitation. And it's really a documentation framework, a way of how we provide service and document it, that illustrates intentional service provision, which means services that are provided in alignment with the service plan that is developed, and certainly services that are intended to meet that person's identified need, as well as meet all the eligibility criteria for prior authorization and reimbursement. So the golden thread really supports a client narrative, an entire story of the entire service journey that a participant undergoes once they've been engaged in services. It promotes safety for that consumer in terms of ensuring that medical necessity is met. It minimizes error in terms of service and documentation. It improves the quality of care for the consumer and ensure regulatory and reimbursement compliance. As well as this is consistent with psychiatric rehab principles, which means there is a commitment and an underlying philosophy of believing that the person has the ability to recover. The person can acquire the knowledge, skills, and resources necessary to attain recovery, quality of life, and community integration. So that's the principality and the concept under which we engage in services in a way that's aligned with psych rehab principles and practices. Any questions there? And please remember throughout this process, we invite questions. You have the opportunity to just say, Earl, stop a moment. Let me get that right. I want to make sure that I get my intended takeaway. So encourage you to continuously engage in that process if a question arises. So for session one, we certainly looked at how goal-directed services are both facilitated and adhered to. So when we talk about goal-directed services, what's important to recognize here is that we are both meeting our obligations in terms of Medicaid standards, psych rehab driven practices, values, and principles. So as it relates to Medicaid specifically, we're talking about how do we ensure that we're meeting prior authorization, which is approval for ensuring the services is provided. person meets the eligibility criteria, they are the right person for the kind of services we provide based on the proven track record that these services actually help the person meet their goal. Right? It's not happenstance, it's not guesswork, it's evidence-based. It is in essence something that has been proven to work. So in other words, when we speak to this, we're talking about how does the service support rehabilitation and recovery of the individual that we're serving. We also want to make sure that the services we provided can pass an audit, right? It meets all the regulatory and compliance elements. So we're making sure that we're providing services that is audit ready. More importantly as well is that it ensures that best practices for psychiatric rehabilitation is actually reflected in our practice. We're supporting recovery, community integration, and quality of life in our efforts. It's individualized, it is person focused. It's really speaking directly to that person's experience, that person's life, that person's skills, knowledge, resilience, all that they bring to the table. And it's collaborative. So we're engaging in a partnership with the participant that really respects that person's knowledge, skills, and resources, their competencies, their experiences, how they see themselves operating in the world, and what's valuable and important to them. Hence, our efforts are really designed to motivate our folks to really define, identify, and pursue their valued life roles. And we talked about valued life roles during session 1, which are, in essence, roles that any individual can actually identify as significant, valued, and meaningful to them and give them a sense of purpose and belonging. And we gave examples of valued life roles, like a person who values being a parent, who may value being a good citizen, who may actually value being an employee, different elements of our societal roles and responsibility that people can actually value and identify with. So that speaks to a concept of seeing our participants as people who, similar to us, aspire and pursue similar goals in life, want to engage in similar valued life roles. So it's imperative that we not only recognize that we are providing services to people who don't have dissimilar needs from us, right? Outside of the fact that they may have a specific diagnostic area that made them eligible for these services, they have the same basic human needs, desires, and want to pursue those in the same element. Hopefully that gives people a framework of how we view what we do and the people that we provide those services to. It's about honoring the humanity in the person that we serve. So we ask, as usual in our engagement, that the knowledge and skills that we discuss and engage in and take away, we want to put that into practice because, research has shown that when we are able to quickly and tangibly put our theory into practice and get some takeaway, be able to come back and kind of review them and process them, we're better equipped to actually take those tools, take those skills, and add them to our toolkit for future reference. And it really enhances and contributes positively to our day-to-day provision of services. So this is not merely about educating you or informing you as to what's the most relevant, what's the cutting edge practices. It's about you taking that information and putting it into practice and having some tangible takeaway and seeing how it actually resonates with you in your daily engagement. Does that make sense? Does that speak to how you see this particular endeavor, this particular engagement? Your time is valuable, and therefore we want to make sure that the time you spent engaging in this kind of tutorial and learning is also experiential. and we were able to kind of assess and evaluate its efficacy. How is it going to work in the field? So, session one's learning application, and that's how we describe it. Really, what you were asked to speak with one of the people that you serve, the participants, about their valued life roles and see how that disclosure may have gone, how that conversation may have gone, and really provide some feedback as to your experiences. So, for those who attended session one and was charged with that specific responsibility to go and put your learning into practice, I want to get a sense from you as to how did it go? Over the past week, did you speak with a participant or anyone else about their valued life roles? And how did that particular practice go? What was it like? What did you learn by asking about someone's valued life roles? And what was challenging or what was, enlightening to you?
Okay. Can you hear me?
Absolutely. Take it away.
Okay. So I had an interesting conversation about somebody's value life goals in wanting to pick up in the day he was a hunter, and
Wow.
he wanted to get back to that, and that was his goal to be that, even though that leaves us with a lot of various things to kind of how do you get back to that. So kind of starting back from what he's got to, exercise and get more limber and do therapy and, just kind of get back to those things. But it was kind of out of the norm of what we were looking at as far as how do we help support that value in that client. So it was pretty interesting.
That's an understatement, Teresa. I love that. It's one of the most consistent or popular response we get. And when we ask people to do it, they're like, I was shocked when someone told me about a valued life rule that I would have never conceptualized, I would have never probably associated with them, or is so far removed from my own values about, what's valuable and what's important to me.
Exactly.
Absolutely. But I think of it. If someone aspires to be a hunter, right? In as much as it may be encapsulated in particular to, just hunting whatever prey. But generally in life, when someone is striving to be a hunter, to your point, you have to be, you have to have so much skills, knowledge, and resources put together. First of all, you have to be limber and able to kind of be flexible in all elements. But I think it's a great trait that someone aspires to hunt, right? Because you're in constant pursuit of a goal, right? Regardless
Yeah.
of what that is. So there's lots of skills and knowledge that can be transferred to other elements of life. So great job that you didn't, just knock it down and say, "What are you talking about? Being a hunter? We're talking about how do you engage in FCS?" But
Yeah.
I think it's critical to know that even if it seems a little out of the elements, you can pull knowledge and skills from that particular pursuit into other areas of their life. So I'm all about, working with a hunter because I'm like, then we're good. You're already
Yeah.
motivated. Let's just put the skills in place for you and you're good to go. So
Yeah,
thank you for
exactly.
sharing that. That's
You
fantastic. So you give us some feedback. Hopefully we'll get a chance to know more about that person's continuous hunting, right?
sounds good.
Absolutely. So we've got some other comments as well. Folks talk about help to slow down and schedule, continue the personal conversation needed to happen between yourself and the client. That was great. Someone said once clients' value life role was to be able to provide and care for their children. Absolutely. In the role as a parent or even as a role model. That's phenomenal. And to get their mental health in order before they can secure employment to be able to provide for their children. I think that that's phenomenal because it gives us some really clear insight as to what's important to that person. Because we can't fall into the trap of believing that when someone comes to us for a service that is really specific to a particular set of services that you provide, and that's all that's important in their lives. They may have, more substantial or overarching kind of values and things that are important to them, whereas the services that we provide may just actually be a small element of their lives and how they see their lives. So that's phenomenal. So there's others folks talked about challenge with the participant express a valued life role, the maintainer, which is working against his stated goals. And that's an important element, Leah. And Leah, thanks for that. You can have, particularly when you have a discourse around valued life roles, someone stating a valued life role that may not seem to align with their stated goals for service. It is important to see and ask that person, explore some more to see what underlines, what really is the foundation of it. Because in some instances, you have examples where, a participant may say, well, my goal is to be a person that is respected or a person that's, in a particular societal concept. And yet at the same time, their current circumstance may not align with that. The reality is to always explore more and more because the more you know, the more you're able to really get a good concept of what is important and valued to that person. And, you can remove the assumptions about what may be apparent or what you may think. And Dorothy says, curious as to how conversations are started. And we spoke somewhat to that in session one, where we talked about how do you elicit that information and some good starter questions. To Dart, specifically to Dorothy, we talked about asking someone about the specific goals of psychiatric rehabilitation as it relates to recovery, quality of life, and community integration. And you can start with the basic question. What does recovery mean to you? Or what's important to you as it relates to recovery? Or you can simply ask that person, given your life experience, what was very important to you in terms of a role and responsibility that you're currently engaging in, or you would like to engage in, or you may have, for reasons unknown, you may have either relinquished or put it not in a priority order. So it's about helping that person revisit the things that are important to them as a human being, as a person, as a member of society, as just a fully functioning adult that they may actually either have not prioritized or don't see being prioritized by the service. So I hope that lends some understanding as to, and there's no perfect way of going about asking that question. Sometimes you just have to ask the question directly, which is, what's the role that most people in society plays, and here's an example that you value. And are you actively pursuing that? And if not, why not? Right? And you get into it. But I think it always stems from the kind of relationship you have with that person. But I'm glad that most of you were able to engage, kind of provide some feedback. Thank you for sharing that and continue to pursue that because as we begin to work more and more with people, those roles may evolve, change, modify, they may shift based on where that person is. It's important to make sure we're checking in. So what is today's focus and what we hope that you take away from today's session? We want to make sure that you are able to identify the key components of the assessment process, to identify the assessment best practices, and to apply the 8 dimensions of wellness to identify strengths and needs. Because we are consistently aligning ourselves with a strength-based, person-centered focus on engagement. and the assessment process in particular. So that's our focus for today, and we certainly hope that we bring that to bear. So, the assessment in the golden thread. It's a critical element, certainly like other elements of the service continuum and the treatment, the service process. But when we speak to the assessment as it relates to the golden thread of FCS, we're talking about a crucial starting point in the golden thread, right? The assessment aspect, the assessment service, the assessment engagement really helps to determine medical necessity and identify a person's strengths, needs, and personal goals. So when we speak to the assessment, we're first talking about how do we establish and clarify medical necessity. And when we speak to medical necessity, we're speaking specifically to how does this person's current circumstance ensure or reflects that the service we're providing is going to be best suited to help that person address that challenge or address that need. So medical necessity really stipulates that the service that is being provided is actually necessary and best suited to help this person address their needs and meet their goals and aspirations. We want to assess simultaneously the person's strengths and needs. What is it that they bring to the table from their life experiences, from their overcoming and from building resilience that is going to inform and hopefully provide them with the level of readiness and confidence and competence to tackle the path towards their indicated goals? What is it about their life experience they can bring to the table to help them best pursue the goals? And in understanding those strengths and needs, we are then going to be able to use that information to help identify a really person-centered and personalized goals that really informs the individualized service plan. So in FCS, the assessment process is a two-part process, and we'll speak some more to what that looks like. But it's important that when we speak to the assessment process, we want to see how it actually, where it is in the whole continuum of care. As you know, we start out a service by really engaging with that person to kind of figure out where they are, why they're here, why are they actually requesting this service? And then we try to assess, is this service medically necessary for that person given their current challenges? What strengths and needs they have, and how do we actually use that to inform an individualized service plan that will help them attain those goals? Hence the golden thread. Does that make sense? Does that give you a full and definitive understanding as to what the assessment in the golden thread of FCS looks like? Where does it line up in the continuum of care and service? Any questions there before we move forward? I want to make sure that we're speaking the same language. We clearly understand what is it we're aspiring to, what we're working on, where our focus lies. Fantastic. I love it. So we're on track. All right. So the question then is, if we're actually focusing on this particular area, what exactly are your roles and responsibilities as it relates to the assessment process? So what I'm going to ask of you, and Seth, things are going fine. Thanks for checking in. I want you to give me a sense as to what role do you play? What's the scope of your engagement in the assessment process? And what I'm going to ask you to do is to provide some feedback for us, I'm going to extend a poll and ask you to take a look and provide some responses to us so we all can have a sense as to what role do we play in the assessment process. So I'm going to launch the poll, and it has a few questions that really speaks to getting a sense as to what role do you play in the assessment process as a matter of fact. So take a few minutes and provide us some feedback if you can. All right, so I'll give another 10 seconds or so for folks to provide some feedback, and then we'll take a look at the poll and see what your responses are like, and so we can have a discourse about your role in the assessment process. All right, so I'm going to end the poll and then look at the results. So we asked, do you complete this FCS assessment? And there was some specificity to that question. Trying to figure out who potentially or who possibly completes the WellPoint assessment only. And about a third of you, a little more than a third of you said you complete the WellPoint assessment. A good fifth of you said you actually do both assessments. So that's pretty nice. And there were some folks that were uncertain or didn't do neither assessment. So that's good to know. A significant number of you do participate in the assessment process. If you complete the assessment, how confident do you feel in doing it? And 43% says very confident. And just about a third of you also said confident. So we have a overarching number of you that are very confident in that role. And what do you hope to gain from this particular training session that can inform that process? I love it. The majority of you, a great majority of you said information and skills. So we're good. I think we've got it. We're all on the same page. We're here to enhance our knowledge and skills at providing and engaging in the assessment process. And that's okay, Anna. We're all, sliding at different parts of the continuum, but the goal here is that we hope that this session can really enhance your confidence and capacity to engage in that process. So what's important to note particularly is as a case manager or clinician, your role is to facilitate a supportive and participant-centered assessment. So it's important to recognize that it's not simply about asking questions and engaging in Q&A and getting as much data as possible. It's the way in which we engage with someone around assessing their needs. We want to make sure that we're supportive. We're recognizing their resilience, their experiences, and what they bring to the table, and asking questions about the information to get clarity. So we want to gather relevant participant history and current concerns through a structural interview or observations. So we want to make sure we're using multiple ways of getting as much information as possible. We want to conduct both structured and, open-ended engagement with our participants. We want to identify strengths, needs, and goals collaboratively with the person that we are serving. And we want to ensure that documentation supports medical necessity for services so that we can ensure that we have prior authorization and we're good at the time of an audit. And also we're ensuring that the right person is in receiving the right service. So that's a major element of it. Bravo. So a clear understanding as to what those roles are and how we engage in those roles. We want to make sure we're being as supportive as possible, gathering as much information as possible, really looking for strengths and identifying needs, and ensuring that we establish or at least clarify whether or not medical necessity is met to ensure authorization, reimbursement, and to make sure that we're prepared for an audit. We can actually clearly and definitively validate why we provided the service we provided, what's the intended outcome, and a way of measuring and assessing whether or not those outcomes were met. That's the whole concept. So as I spoke to earlier, there's a two-stage assessment process in FCS, and it's important to recognize those processes. So when we speak to the two-stage process, we're talking about the WellPoint uniform assessment. So as you know, WellPoint Washington Inc. is the agency or the HMO that provides prior authorization for Medicaid fee-for-service units. So we have to ensure that we're meeting that expected criteria, right? So when we speak specifically to the uniform assessment, we're talking about how do we identify immediate service needs and establish medical necessity. So when we speak to uniform assessment, we're talking about truly identifying medical necessity, whether or not this person meets the eligibility criteria for this service, and this service is the appropriate and tested approach to providing for that person's needs. We look at and we engage in an active discourse and sharing of information as it relates to supportive housing assessment. We look specifically when we speak to the supported housing assessment, we're talking about how do we clarify and establish that the person meets certain criteria. Mental health needs, particularly where there's a need for improvement, stabilization, or prevention of deterioration in functioning that results from that person's emotional or psychological condition. Or a diagnosed substance use disorder. So we have a list of criteria that person has to meet in order to qualify for the service. And that's important. Then we look at risk factors as it relates to supportive housing or supported employment. And that may include chronic homelessness, frequent or lengthy institutional contacts, frequent turnover in home care providers, and a PRISM predictive risk score of 1.5 or above. So there's some clear and definitive criteria for establishing both medical need and meeting risk factors. And that is specific to the supported housing element and the supported employment element, as well as meeting the age-related criteria. Any questions there? Is that clear to folks in terms of establishing the criteria for supported housing and supported employment, and that's part of the uniform assessment process? Fantastic. Then we have the comprehensive assessment, which is more of that real clinical picture, really looking at that framework. We want to look at exploration of strengths and needs. What does the person bring to the table? What their life experience has informed, has equipped them with? What are their needs? And are those needs aligned with the service we provide? And there are specific tools that are used, and that may be agency specific, it may be service specific, but there are different assessment tools which may go from a psychosocial assessment to a specific functional assessment across the board. So if you can take a moment and think of what comprehensive assessment tool does your program use? And if you can share that with us, you have a sense as to whether or not they're consistent across the board or they're different. And I see a lot of feedback about when you talk about supportive housing, I love it when people say, hold on a minute, Earl. We have so much issues with housing that we need to get into that. But we'll get into that at the rate. Right now, we're just looking at what is it we assess for? What is it we try to get a sense of? So we have here, people use Google Forms and paper forms. There's a supported housing assessment that is specific. Is there a particular kind of, so Dorothy said there's psychosocial, SUD assessment. So there's a variety and probably a compilation of assessments that are used to really assess across supportive housing and supported employment. What is very unique, and I can't say specifically to Washington, but what is obvious in Washington is that you guys have such a diverse service entity that oftentimes you provide a wide range of service that may require a wide range of assessment processes and tools. So there's the housing equity assessment, master housing package, chronic homelessness assessment, housing barriers. So as I alluded to, there's a tremendous amount of diversity and variety in the assessment tools that you use, and some may be specific to your agency, some may be specific to the services you're providing. Certainly, there's no right and wrong. I think that you certainly have to ensure that your service or your agency aligns with the assessment you're providing, and you're making sure that you're using the right tool for that assessment. So there's a career profile assessment tied to an employment service plan. Bravo. So every time I do this training, I learn more about assessment tools, and I'm always grateful for your sharing. But just ensure that you have a clear understanding as to what your agency actually mandates, and it may be agency specific or service specific. But those are the dual assessment approach that is used in FCS that is important to recognize. So let's look at the WellPoint assessment that establishes medical necessity, because that is evident is one of the consistent one across the board. And thank you, Annette, that you have to use what you're allowed to use. I certainly can understand that. So when we speak to the WellPoint assessment, we're talking about how does it help us establish medical necessity. And here are some clear and definitive path, the path to which we were able to establish medical necessity. We look at the health needs. Does the person need mental health improvement, stabilization, or prevent further deterioration of the person's mental health condition? Is there a need for assistance with activities of daily living? There's some specificity with regards to that. Does the person need substance use disorder treatment or services? And that all helps to establish a health need for the service. It ensures that the service provided align with medical necessity, because this is a critical step for funding the service and ongoing care planning. You also have to determine whether or not the person meets the risk factors. And that can include deterioration of a mental health condition or functioning, substance use condition. Is there significant dysfunction in the role performance? Can that person engage meaningfully and tangibly and successfully in the role of a parent, in the role of an employee, whatever role they're functioning currently in their life that is a valued life role? And whether or not they have experienced with frequent or long institutional contacts that actually speaks to their functional capacity. So when we speak to medical necessity, we're talking about how do we determine and clarify whether or not the person has the health need and the risk factors that make them eligible for this service. So think of what are some of the common health needs or risk factors for your clients. Are there other risk factors or other health needs that is not described here or not articulated here that you find commonly in the people you serve? And what do they look like? And I see you ask a specific question here. Okay, ask if someone can help me answer the question. Family of four, a criminal crime victim, LEAP child, and a kindergarten child that don't have and jumps to trauma. Where do they go? I think that it's difficult to clearly understand the question. If you can, I don't know if you have the capacity to unmute and ask that question, Annette, but I certainly would like you to get some feedback from folks who may be familiar with a, client of that sort. But
All right, I will try to say it better.
go right ahead.
All right, so if there's a family of four, there is a crime victim, the hubby is technically a felon, and we have a son that has special needs and another son that's very young. Where can you, and you live in a county where there's no housing, but you can leave the county. How can you assess them when they all hit different needs?
It's an
Does
interesting
that make sense?
question. Yeah, it does. In terms of really looking at, are you assessing the entire family? Are you assessing the individual components of the service that you're hoping to provide? It sounds like, and this is just speaking because I'm not
It's me. Don't worry.
specific to Washington services, but it sounds as though you're talking about a family that has very diverse and complex needs. And generally you assess, all the components, right? Whatever is
Yes,
coming to the table that really informs how you're going to actually establish priority needs or whether or not FCS services can actually meet this family's need at the best rate.
that's pretty much what I
Certainly,
was trying to get at.
and I understand that very clearly. You talk about a complex presentation there that I'm sure that the answer may be very complex. I don't think there's a one way of serving a family that with such presenting concerns. But we certainly in FCS, we're looking at how does supportive housing or supported employment potentially support that client, the clients or the collective. And it may be more than simply what FCS can provide. You may have to have some other services scaffolding that those supportive housing needs. So it may require some diverse planning around how do you best support the family beyond just keeping them
Yes,
housed or keeping them
thank
integrated in the
you.
community. All
Because
right.
we stick together. That's what family does. So I don't mind.
Absolutely. And I'm hoping someone from DBHR is on the line or engaged here that may be able to provide you with some specific guidelines if that may be the case, okay? But thank you for the question. Fantastic, and there's lots more feedback. You know, we talk about starting with who the client is. Many families have multiple needs. We talk about Commonwealth health needs that are mental health stabilization and needing a caregiver. So, like I said in the interim, the service you provide are oftentimes very diverse and expansive. So therefore, you probably address complex needs and multiple needs across the spectrum. But I think when it speaks to FCS, we're talking particularly about how does supported housing and supported employment potentially meet the participants' needs. And there's lots more common presentations, mental health or physical health need, triage needs, vital first. We talk about starting with really, and to Dorothy's point, sometimes it's just starting with meeting that person's basic needs, right? Food, housing, shelter, the basic needs, and then looking at the needs more specific under those umbrellas. But thank you all for sharing. So then we look at the second part of the FCS assessment process, which is the comprehensive assessment. And we want to look specifically at exploring past and current experiences and interests. Where does that lie? How does that inform the person's current circumstance and current desire, their hope, dreams, and aspirations? So we want to perform a deeper dive in agreed upon areas. So it's important to recognize that to fully understand an individual's unique needs and challenges, a comprehensive assessment must go beyond just simply determining medical necessity. You have to go beyond just medical necessity. We want to dive into that areas like housing, employment, and other aspects of daily living and daily functioning. What sets this approach apart? What sets FCS apart is the focus on interactive, dialogue-driven engagement, where the conversation with the individual can go far beyond simple facts. So we want to look at more than what the person is just immediately focused on, right? We want to have a discussion about their past experiences and about how those current interests, hopes, and dreams really inform how they define goals. We really do a deep dive and hope that from that conversation, we can identify goals on an individualized service plan. We help the person identify the needs and the strengths that they currently have, so that they can do their best in an attempt to thrive, not simply to survive or exist in the community, but to thrive, to attain some level of recovery, to pursue the highest quality of life, and to be able to integrate meaningfully, tangibly, and purposefully in the community. And that may require asking questions. What worked in the past, to Dorothy's point? What didn't work? What were some obstacles? How were you able to overcome obstacles in the past? So what's important as well is that it needs to be a comprehensive assessment. It needs to be complete and accurate. So we must get as much information from as many sources as possible to inform this process. And to Annette's point, is developing some level of trust even before we can do a deep dive. But the comprehensive assessment is a second part of that two-part process. So we have the uniform assessment, establishes medical necessity, then the comprehensive assessment, it really looks at the person's strengths, resilience, experiences, hopes, dreams, and aspirations, and how they see the services really impacting their ability to thrive and to attain the psychiatric rehabilitation goals in the community. Why might an assessment be incomplete or inaccurate? Because we don't want to assume that by just some natural stuff, we're going to be extremely competent and capable of this by happenstance. There are some instances where there may not be enough information, or they may have some questions about accuracy in terms of assessing someone. And the question is, why might an assessment be incomplete or inaccurate? What may be some of the challenges to completing an assessment? Ah, fantastic, Kay. Someone may not want to open up or be ready to speak to us, right? It may take some motivation, trust, a lack of trust. The person may not be lucid enough, may not have the mental capacity to answer all the questions or to provide information. Sometimes the questions themselves are restrictive or limiting the types of answers. You ask a question with open-ended, close-ended question, you may get a no or a yes, as opposed to really using an open-ended question to really get the person to expand upon their concerns. TBI, memory loss. That is an important one, Miranda. Some people may have had experience in the past where they feel if they talk about their history, it can reflect on them negatively, especially with substance use disorder or mental health. People may be cautious about disclosing too much for fear of stigma or fear of being judged. The person may be actively in the throes of use and may not be in a place where they can engage meaningfully. The assessment is structured and defined, but people are complex and nuanced. And Michaela, that's important. So it's trying to get that person to really engage in a trusting, meaningful, sharing, collaborative engagement with you. And that takes skills. They may have, history of past history that may be complex. So it's important for us to not simply only understand what is it we're trying to attain in terms of information, but how we go about doing that may be just as significant and informative as how much we get from that person to inform our assessment process. Culturally relevant questions. Absolutely, Dorothy. The same question may impact different people very differently based on their cultural perspective, their cultural experience. Under our current circumstance, both politically and what's going on, people may be reluctant to answer certain questions. So we have to be thoughtful and compassionate and honest. And Sabrina speaks to another point. Someone may didn't want to disclose some demographic for fear of limiting their resources they have to access. Absolutely. Do you meet Medicaid criteria? The person, I don't want to tell you about the extra, $500 that I have in this bank account here. I don't want to disclose that. That may disqualify me from certain benefits. But you have to also let folks know that, listen, deceit is not going to help you as well, because at some point this information will have to be disclosed. So it's important to be honest and thoughtful and compassionate as well. So the comprehensive assessment, what are the best practices? As we know about what we need to do, we now need to look at how do we do it in the best way possible to get the maximum and the most positive responses and the most positive engagement, and develop a therapeutic alliance with that person that is going to help us as we engage in services with that person. Because it's not simply about completing this assessment. It's about what kind of relationship are we establishing so that we can work meaningfully, thoughtfully, and effectively throughout the therapeutic relationship. So what are some best practices? We want to ensure that we include all available information. We don't want to limit our information to sources that we think are the only sources. We want to make sure as much as possible we get as comprehensive information as we can to inform the assessment. We want to make sure that we focus on wellness over deficit. And that may be an essential starting point, a critical starting point. If you go and you started by asking someone, what is the problem? Or I noticed that you have A, B, C, D. How does that affect your, EFJ? When you start out that way, you're lending that potential viewer perspective that you're here to shred out or discern the person's deficits and problems, as opposed to simply engaging with that person around, tell me about what is it you need to help you get to where you need to get. What's going to actually enhance and promote your wellness, as opposed to what problems do you have? What is the issue with you and your substance use? What is the issue? Why aren't you, why is your mental health compromised? It's not the way to go about it, even though in some instances that may be the way people approach it. The reality is the best practice speaks to really focusing on wellness and not focusing on deficits. I don't think any one of us, I know from my own experiences, I would have a difficult time trusting someone and engaging a meaningful relationship when that first word out of that person's mouth or the first engagement is around what I can't do or what I haven't done well. Active listening. It's a great place to start, absolutely. Where would you like to start in your recovery? Great, great questions. Be strengths-based. Identify unmet needs. So we're going to look at those elements individually and really get a good concept as to where we are in those processes. So let's look first at how do we ensure we're including all information that really informs the assessment. We want to make sure that we use all the elements available to us, all the paths, all the ways of getting as much information as possible. We want to make sure we have the client or the participant self-report. What responses conflict with observations? You're speaking to someone, they're speaking about their successful efforts at recovery, substance use recovery, but, at the same time, the person is reeking of alcohol in the environment in which you're engaging. It certainly may not be prudent to say, well, I'm a little concerned that you're talking about recovery, but you smell like alcohol. That's certainly not a meaningful way of getting someone to trust you and establish a meaningful, honest response. You may certainly want to give your observations. What has recovery looked like for you? What has been some of the successes you've had in your efforts to stay sober? And the person may speak to you and say, listen, I'm in recovery, but I'm approaching it from a harm reduction standpoint. And therefore, I'm in the process of just reducing the amount of consumption that I have. I am not all about, sobriety in total. So that's important to know. Staff observation. Based on the information in terms of the referral package and what you hear from the consumer, what isn't being said? And how do you approach that? As opposed to saying, well, I don't think you're being honest here. Your referral package says A, B, C, D. You may want to actually shift that paradigm in terms of the question to say, could you help me understand what does it mean as it relates to the referral package that says A, B, C, D? Can you help me understand how does that resonate with you? And the person may be able to say, well, the referral package was done when, I was in this state and therefore the information I give wasn't accurate, or it was accurate. I just see myself differently today or view things differently. You may get some feedback. What's already been worked on? You can't assume that the person is a stage one unless you fully ask the question and get a good understanding as to where the person is. The well-point assessment may also inform you in terms of what responses do you want to know more about. The person speaks to their particular experience, their history. Referral and intake information may help you determine what's included, what's missing, what do you have to do some more work to get information on. So these are good guidelines, but these are the different modes and modality in which we can get as much information as possible to inform the assessment. Collateral contacts. So it's really about building trust by establishing to that person that you want to get as much information in terms of their experience with service, in terms of their particular where they are in their recovery, where they are in their processes, to help best focus your efforts and their efforts on what's important, what's critical, as well as what they truly need, as opposed to what you perceive their need to be. Self-directed, more autonomous kind of engagement, so that you're actually preparing that person for taking more and more responsibility for their own recovery. Absolutely, Anna. You're talking about connecting with that person in a respectful, partnership approach as opposed to an interrogation. So let's look at the best practice. Number 2, how do we ensure that we're really promoting self-reporting and using open-ended questions? You want to make sure you want to focus on not asking too many close-ended questions, and someone alluded to that as well. Close-ended questions tend to produce close-ended responses. You don't want to limit response choices, right? You don't want to ask what, where. You want to ask some more. Tell me more about what your income source has been like over this period. Draw a picture for me in terms of what your current living environment is like, what your current residence is like, as opposed to where you live. Some of it may be more demographic and specific to inform the assessment, but some of it may require more of a conversation. What does that look like to you? Absolutely. It's a great way of really allowing that person to give you some more comprehensive insight as to how they see themselves operating in that space. Start with an open-ended question. So it's important to facilitate self-reporting by using open-ended questions, by using your MI skills and tools, by really engaging with that person in a respectful, collaborative, compassionate way. So they're not feeling that they're under a bright light being interrogated, but more engaging in a conversation with someone who is committed to helping and supporting them. So we want to take a quick look at how do we focus on wellness? It's a critical best practice. Focus on wellness. How do we do that in a way that is meaningful? And I want to share a video with you that really focuses on wellness. And give me a thumbs up if you're able to see the video. Oops, and bear with me one moment. So we're gonna have to back. Here we go.
The Substance Abuse
Bravo.
and Mental Health Services Administration, or SAMHSA, created the Wellness
You see your
Initiative
computer.
to help people with mental and/or substance use disorders, and all people, live longer, healthier lives by focusing on the 8 dimensions of wellness that connect all aspects of behavioral health. Improving wellness by taking action on each of these dimensions addresses early mortality from treatable and preventable conditions. Embracing wellness is about life and living, and becoming the healthiest you possible. Listen to your feelings, express them to people you trust, and maintain a positive outlook. Make it a point to understand your finances, establish good financial habits, and plan for the future. A sense of belonging and a reliable support system help during difficult times. Make at least one social connection daily. Seek advice from peers or support groups. And create healthy friendships. Enhancing your connection to self, nature, and others brings balance and peace to your life. Take time to discover what values and beliefs are most important to you. Look for satisfaction from things you're passionate about, whether it is through work, school, or volunteering. Reduce your risk of many illnesses by increasing activity levels according to your abilities, getting restful sleep at night, choosing healthy foods, and exploring outdoors to reduce stress and increase energy levels. Be a lifelong learner by expanding your knowledge and finding creative outlets that stimulate your mind and sense of curiosity. Be open to new ideas, insights, and wisdom. A positive environment has a calming effect. Find surroundings that encourage good physical and mental health, and where you also feel safe. At SAMHSA, we envision a future in which people with...
And I wanted to provide that kind of overview of the wellness kind of focus. So we're talking about really addressing the needs and aspirations of that person in the 8 dimensions of wellness. Share with me if you can, if you're familiar with the 8 dimensions of wellness. Give me a yes or a no, so I know how much we need to kind of go beyond what is already described in the video. Okay. So the predominance of yeses, but there's also a few no's. So certainly want to make sure that we're not overlooking this element because it's critical. So when we talk about a wellness approach, we're talking about looking at the person's strengths and needs as it relates to the 8 dimensions of wellness. And the 8 dimensions of wellness include emotional, financial, social, spiritual, occupational, physical, intellectual, and environmental domains. And each one, I think, was clearly described in that area and what we can do to maximize the person's benefit from addressing those concerns in all those areas. The reason why we do that is that we want to look at the whole person. We want to make sure that we are addressing needs and strengths in each one of those areas, because as we know, typically people are addressing any kind of goals in their lives, they tend to overlap. Right? Typically, if people have financial needs, it tends to also impact them socially. It may impact them physically. It may impact them environmentally. So we want to make sure that we're looking at that whole person and the intersectionality of those domains. And that's an important point, Annette. Yes, when people have a trauma experience or an issue with trauma, it tends to impact people in all of the domains. And that's very classic across a lot of other areas of need. It tends to kind of intersect or overlap. So that's important for us to recognize the need to look at the whole person and how their presenting concerns may actually reflect on or impact specific dimensions of wellness. So we want to do a little practice. So what I'm going to certainly ask is, want to look at some scenarios, and I want, if you can, think quickly and then give me a response as to what dimension of wellness you think this particular scenario speaks to or illustrates. So here is the first scenario. The participant you have wants to learn how to cope with stress. What dimensions of wellness do you think this focuses on? Learning how to cope with stress. What dimensions of wellness you think is impacted by that need? emotional, physical, social. I like that, Shannon. Could be any one of those areas. So a classic example is if the stress is associated with a specific environment, it may be environmental. If it's associated with specific people or a specific social engagement, maybe social. If the person is stressed by their job or stressed by a lack of income, it may be financial. You need to talk with them and find out. You can't just assume it if a person says, I have, I want to learn some stress management tools, it's just associated with just the emotional wellness. So that's a good example of how it may have a lot of intersectionality, may have overlapping many areas. Let's try again another. Choosing the best environment for myself. The person is trying to find housing and they're really focused on how do you choose the best neighborhood that best meets their need. What area of what dimension does that speak to? Ah, that's interesting. The first person said financial and social. Environmental, absolutely. Emotional, once again, you see, even though it may appear to be one specific focus, it can have a kind of a ripple effect across many other dimensions of wellness. Now, finally, I'm going to throw another one at you because we're gonna enjoy this practice session. Sticking with my recovery plan. The participant is focused on sticking with their recovery plan. What dimensions of wellness is impacted by this area of need? Someone says health. It depends on the plan. All. I think the biggest question here is what's the person's recovery plan, right? What does it speak to? Because it doesn't necessarily have to only be substance use recovery. It can be a lot of other things. The person can have recovery in general, in their lives. So I think that's important to recognize that oftentimes there's a lot of overlap in the dimensions of wellness and how a particular need or presenting problem may actually be affected or affect all the dimensions of one's life. So thank you for engaging in that, but I just hope that that specific message resonates. That you can't just assume that because the person presents with this particular problem and it's more associated with one dimension, it's limited to the impact it has on that dimension alone. Remember, wellness is interdependent. So lots of areas are impacted by even the most mundane or the most basic pursuit. Apartment applications or transportation may impact all the dimensions of wellness in that person's life. And I like that, Anna. Oftentimes, the 8 dimensions connect together with every question that you present to someone or a need that they may have. But once again, it's important to actually engage in a conversation with that person to get a good understanding as to what is it that it speaks to that person. What's the primary focus that that person may have? Absolutely. So, best practice number 3, we talk about being strength-based and identify unmet needs. How do we do that? How do we approach that? In FCS specifically, when we speak about unmet needs based on the service we provided, we're talking about housing and employment. We're talking about supportive housing, supported employment. ADLs in the areas of wellness related to housing. What are some of the current unmet needs of people who are coming into foundational community support? What are some of the most common unmet needs that you encounter? Are there a primary, more of a supported housing or a supported employment focus, financial. There's a pervasive amount of financial, social, physical, food, medicine, PCP, legal issues, jobs, access to transportation. And I love it. Miranda puts a capitalize affordable housing. And that's beyond Washington. That's across the entire nation. Affordable housing is one of the major unmet needs for folks. Past justice employment, high school completion. It may be academic, it may be vocational. So there's lots of areas of need. But we have to focus on what can FCS actually extend and provide support that really addresses some of those concerns. We want to focus on strengths from relevant area, experience, existing knowledge, skills, and resources. So the best place to start, and we recommend as the best practice, is to get a sense as to what is the person's current knowledge, skills, and resources as it relates to the presenting concerns or the need. And there's a particular approach to exploring that entity. We want to make sure we get a sense as what is your current knowledge about financial management? The person may simply say, listen, I have never done a budget in my life. So, okay, so we're talking about understanding what budgeting is like and maybe looking at how do you learn budgeting skills, how do you learn fundamental ways of managing your stuff, your finances to meet your needs. And the person may say, well, I can count very well. My math is pretty good, so I bring that strength. Or the person may say, listen, I have a representative payee who manages my finances. So I may want that person involved in the planning process of addressing my needs. So you have to really explore what the person's current circumstances are and what knowledge, skills, and resources they currently have and what knowledge, skills, and resources they may need to meet their goals. Does that make sense? Does that resonate when we talk about knowledge, skills, and resources that are available, that are tested, and then those that have gaps in terms of competence and what they may need? Absolutely. It may help that person who may currently be thinking that they don't have any competence or knowledge to really recognize by those kinds of exploration that they do bring some resilience and knowledge and competence, right? All is not lost. The person may have some knowledge, skills, and resources that they can actually activate that may actually lend itself to some more self-directed and autonomous approach to meeting their needs. So let's look at a case scenario to give us some more practice. So I want you to meet Vanessa. We're trying to assess Vanessa based on her presentation. Now, Vanessa is a 27-year-old Chinese American woman born and living in Seattle. She has a diagnosis of bipolar 1 disorder with delusions. She has lived in the community for the past 3 years with a few short-term hospitalizations. Recently, her primary care doctor informed her she is pre-diabetic, which concerns her since she has relatives with diabetes. She reports that when she isn't working, she often sits at home watching TV and eating junk food. The team observes that she doesn't cook or have access to healthy food options because she lives in a food desert. There are no supermarkets within walking distance. She reports she always has enough food to eat through SNAP benefits and a neighborhood food pantry. Now the question is, given what we know of Vanessa, what is an unmet need for, and I use Angela, my apologies, for Vanessa? Nutritional foods. proper nutrition like pre-made meals, transportation, access to healthy food, possible employment, unmet health needs, motivation to exercise, treatments for her diabetes, and the list goes on. Now, what is the most critical thing we learned today? We talked about today, about trying to discern what a person's need truly is. Absolutely, Kate. Ask open-ended questions to find out more. We may want to actually explore with Vanessa how she defines her needs, what she thinks is most important to her, where does she see this relating to her health and wellness, and not simply throw possible solutions at her immediately. And Annette says it. How does her current presentation potentially inform the impact on the 8 dimensions of wellness? What is a related strength? See, the first thing we can automatically assume is that Vanessa has all these needs and we can just come up with a list of recommendations. But have we taken a moment to stop and really try to discern what strengths does Vanessa have? She has a PCP. Otherwise, she wouldn't have been diagnosed with prediabetes. She's working. She has access to SNAP and food pantries. She's honest, connected to a doctor. Sounds like she eats better when working. She's housed. See the shift? When you actually step into it from a wellness perspective and a strength-based perspective, you actually can engage in a discourse that really starts at the place that you can meet with the heart and the head. She's establishing the community. So if the conversation and discourse starts with recognizing Vanessa's strengths, it may be a lot easier for her to talk to you about her needs and her challenges. What is the potential goal for Vanessa? Given what we know about her strengths. We talk about the employment, we talk about family values. We'd like to ask to find out, could be healthcare, could be finding healthier food options. And that was funny, Carl. Sorry, I'm using the word, the name Vanessa and Angela intermittently, but we're talking about Vanessa. What is a potential goal? Managing her prediabetes status to prevent diabetes. Request that a PCP refers her to a nutritionist and can help navigate SNAP. So there's lots of potential goal areas, right? But I think the most critical one is to really determine and help Vanessa determine what's of the most critical element to her. What's her more critical need at this point? If we don't get Vanessa to kind of articulate what is most important to her, what is she most confident in and ready to address, we're simply throwing solutions without actually discerning what's important to that person. Because with all of this going on, Vanessa may actually be able to say to you that, listen, I know all these things are, evident in my life, but what's most important to me is to find out how this potential diabetes diagnosis may actually impact all of my life. Precisely, Heather. Addressing the whole person. We have to determine from Vanessa what is important to her. What does she find critical? So we can't simply assume that because this presentation is a blitz, we can actually discern what's a priority, what's a basic goal for her. She has to determine, and we have to elicit, we have to kind of take a deep dive on what's important to her that she wants to address first and paramount. And it could be any one of these areas that we consider to be areas of challenge. Does that make sense? Does that resonate with you in terms of really looking at it from a compassionate, thoughtful, collaborative partnership approach? Fantastic. And that's the biggest message for today. When we talk about deciphering or determining based on our assessment, what is the person's goal, we have to get that information from that person. And that, to Jennifer's point, asking her the right questions to really discern what exactly is it that she wants to work on, what's of major importance to her. Because Vanessa can also tell you, well, I've seen most of the folks in my family live with diabetes for, till their 80s. So that's not important to me right now. What's important to me is, making sure that I'm able to access food. Maybe transportation, maybe knowledge about nutrition. I want to make sure that I'm able to share this information with my loved ones. It may be a lot of different things. So normally we'll take a break, but I think we're in a good rhythm. So with your permission, we'll keep rolling. Is that okay with everyone? Absolutely. So we'll keep it rolling. So we want to look at an assessment tool that will really help us to discern, and to the point I was making, how does that person view their needs, what they consider a priority need, and how they consider that should inform a specific goal. So we use, in general, what is called a multidimensional wellness worksheet. So it's a comprehensive way of looking at those dimensions of wellness and really trying to discern what's the knowledge, skills, and resources that the person has and the person needs, and how that informs the development of a goal. So for those who may not be familiar with the wellness worksheet, and it's one used prominently in New Jersey. In some instances, we've talked to folks in Washington about using it, and it's been adopted. But I want you to get a sense as to what it looks like. So the wellness worksheet really looks at all of those 8 dimensions, and it looks specifically at how do we explore that person's wellness, right? Where is that person right now, and where would they like to be? And we use that on a Richter scale, right? On a Likert scale, my apologies. On a Likert scale, from 1 to 5 in terms of, 1 being not so much, and 5 being, it's really a way of helping that person identify where they are in their idea, their sense of wellness. So the wellness worksheet looks like that. It really helps that person organize and analyze their strengths and area of need. And we'll look at a specific example. So we're looking at the social dimension. And how does that person assess and analyze and provide feedback to you as to where they are and where they would like to be? So we look at it from a value of 1 to 5 to indicate where that person is. And if you look at this example, we're talking about a social need for that person that's developing relationships and a strong support system. And that person is now able to determine, or at least provide some feedback to us as to where they are now as it relates to developing relationships in a social support system, and how they would like to see themselves, where they would like to be. So it really helps that person assess their current circumstance and then explore their aspirations, where they would like to be in that process. And Laurie, yes, today's recording and session will be available to you. And I like that, Kedrin. What a 5 would mean to you, or what does a 1 look like, or what does a 2 look like as it relates to where you are, where you would like to be? So this is an example of how we use that kind of wellness worksheet in specific dimensions to be able to kind of get a sense as to where the person see themselves. For each dimension, you ask the person to choose a value of 1 to 5 to indicate where they are now in a particular dimension, and a value of 1 to 5 for where they would like to be. How familiar are you, or have you used that kind of Likert scale before to measure, to scale a person's perception of where they are and where they would like to be? Is this familiar to you in terms of using that kind of scale? Okay. So this is a new context to some folks, okay. But generally, it really helps that person take charge and take control of giving you feedback specific to how they perceive things. And not, it's more a subjective measure. So it really helps that person take ownership and give you some perspective. And Sabrina says they do use this worksheet. So if you've used it before, it's really effective. And if you haven't, it's not a very difficult worksheet to use. It really take away the you being in charge, you actually making the assessment as opposed to that person really providing you with some feedback. So we look at how do we use this wellness worksheet? And I'm going to ask my colleague to kind of help me kind of role model, how do we use this particular wellness worksheet. So we're looking at the social wellness dimensions, and there are some specific questions and responses that will help guide you. Want to kind of frame it out where we're kind of modeling an engagement with a participant and a counselor.
I wasn't muted. I wasn't unmuted. Hi, Earl. I'm ready.
Fantastic. Take it away, Emily.
So, Earl, I'm really excited to meet with you today. Thank you so much for agreeing to do so. I know the last time we met, we started working on the wellness worksheet and we were reviewing some of the other models of wellness. I know we talked about your physical health, we talked about employment. I was wondering if today we could start off talking about social wellness.
Absolutely.
Okay, great. So when we're thinking about social wellness, Earl, we're really thinking about the people in your life, whether that be friends, whether that be family, whether that be your community at large. So I guess my question for you is if you were to rate your wellness on a scale of 1 to 5, 1 being the least well and 5 being the most well, how would you currently rate your wellness?
Wow, that's a good question. On a scale of 1 to 5 in my wellness, I would say right now I'm probably at a 3. Um, and I would like to get to a 5. I'm hoping that I'm able to get to a 5.
Okay. And that's so if you're telling me 3, so that tells me you're kind of in the middle. And I think that makes a lot of sense that you'd want to eventually get to that point where you're feeling the most well out of 5. So I think that makes a lot of sense. So why don't you tell me a little bit about what a 3 means to you? I guess what are currently, how would you currently describe your wellness, your social wellness?
Great. And the reason why I said a three is because, I've got a lot of my friends that I've had for a long time, but I am in recovery. I'm in a good place. And a lot of those friends are still kind of, they've
Mhm.
gone through relapse over and over again. And I've been told by my sponsor and the people I'm engaged with that I need to be focused on the, people, places, and things and how they contribute to my recovery. So
Yeah.
I would really like to get to a point where I can actually maintain friendship with some of those people who are struggling and not have it trigger my, relapse or undermine my recovery.
Sure. Yeah, so you're currently in recovery and you're currently at a point where you're satisfied with your recovery. But even though you are also satisfied with the friends that you have, and I'm guessing also kind of satisfied with, your ability to maintain these friendships, it also sounds like you're kind of in a tight spot because some of the people that you are friends with maybe aren't as engaged in their recovery. And your concern, which I think is really valid, is that if you continue to maintain some of these friendships, you might be triggered and it could potentially impact your recovery. Am I getting that right?
Absolutely. That's exactly what I'm, thinking. That's where I am.
Okay. And just to clarify, um, are you looking to expand your friend group and maybe be friends with more people who are also in recovery, or people who maybe don't struggle with or have a history of using substances? Or are you looking to figure out how to maintain these friendships without being triggered?
And I think you hit it spot on. It's on both because
Okay.
what I want to do is to have actual some good friends, solid friends that are outside of the recovery kind of scope because sometimes that's overwhelming. I just want people who I don't have to talk about my substance use with. And yet at the same time, some of the friendships that I have over the years, I want to learn how to kind of maintain some level of friendship with those people, but maintain some good, healthy boundaries.
Yeah, yeah, and that's the word that definitely came to my head for me as you were talking is boundaries, right? It sounds like you want to be able to maybe develop some stronger boundaries with the friends that you have, but also be able to just make new friends in the community outside of your identity as somebody who is in recovery.
Absolutely. Yes. Sometimes I want to actually think about myself, as a person who's functioning like everybody else and not only about substance use recovery, as well as to have a way of giving back and supporting those people who are still struggling.
Absolutely. Yeah. So it sounds like you're really hoping for two things. You want to be able to maybe learn some skills related to boundary setting and maybe assertively communicating with some of your current friends. And you're also interested in making new friends in the community. At the same time, you know how to be a good friend. You've been able to maintain the friendships that you've had through ups and downs, it sounds like. So I think that's definitely a strength is that you already have a lot of skills relating to being social and maintaining friendships. So it looks like your goal is to expand your friend group and maybe learn some skills to support you in doing that.
Absolutely. Yeah. I certainly want to learn, like I said, how to make some new friends, maintain those friendships, and kind of maintain my old friendships without losing myself and losing my recovery as part of that.
Sure. Yeah. So I think this, it sounds like we have a good goal for you and we have a good direction to go in.
Absolutely. Thank you so much. I'll see you next week. Thanks as usual.
Thanks, Earl. Take care.
You're welcome.
And scene.
Bravo. So I'm hoping that, and I know, and let's make a quick disclaimer. We don't expect every consumer and counselor to kind of have that kind of trusting, kind of fluid engagement, but it's a good example as to how you really utilize that worksheet, that tool to get that person to identify where they see themselves in terms of a score, where they want to be, and what it looks like. I certainly want to get your feedback as to how do you see that role modeling kind of informing the use of that tool? Was that helpful? Bravo. Glad that people found it to be helpful in that sense. Absolutely, Annette. I love that. She says, don't expect to get an Emily. She's one of a kind. Absolutely. And she's ours. So we're holding on to our Emily. She's certainly one of a kind. But yes. And Emily put the wellness worksheet in the chat so you can actually download it if you're not familiar with it. But I'm glad that that specific kind of engagement was helpful to help articulate or at least give you a sense as to how the person's seeing using that tool in a conversational mode and not just in a didactic kind of let's ask this Q&A kind of engagement. Any questions there? Any feedback? Okay. I'm glad. I'm practicing my acting skills, so work with me on that. So I wanted to certainly get you to go into to practice this, but I think the based on the feedback, the modeling and the role modeling of that using that worksheet, I think suffice. So you don't have to necessarily go into the breakout group. I know it takes a bit of time and we want to kind of keep it rolling. So any feedback specific to that role model? Will you think you see any part of it you would do differently? Was helpful, that was insightful for you? How did you see Emily identifying my unmet needs? How do you see her identifying my strength? And how did she articulate the potential goal? And how do you see that working? I love that. Yes, she is ours. Absolutely. Any questions there? Because we're going to move into really looking at the goal development element quickly. I can't said Emily spoke about meeting with you last week. Is the worksheet typically spread out across multiple appointments? In some instances, yes. There is no specific amount of times that you have to meet. I think whatever amount of time you need to meet to really inform that worksheet well enough is good enough. Some people may not be ready to kind of engage in the whole process, and it may take multiple sessions, but the expectations is that you prepare that person that in that session, you kind of get the most out of it. I thought it was very helpful for us and the client, for Emily to reiterate back to the client to ensure that the therapist, caseworker, etc., fully understands who they are working with. Absolutely. So providing that feedback as to getting confirmation from the person, is that what I'm understanding? Is that what you're trying to relate? Is that really clarifying that what you're observing and what that person is saying or what that person is sharing is meeting at the same place? Using those reflections, absolutely. And yes, that's a major element, a major point to note here. Emily's use of the reflections and how it incorporates the client's expressed strengths and goals. And you notice it was a process of getting to the goal. It wasn't about creating a goal out of, a question and answering, but more a discourse that led to the goal, where the person actually articulates it. Emily just put it in a kind of a clinical package. And to Emily's point, we love to see you use it as an engagement tool with new clients, right? And using over multiple sessions to really get to know the clients and understand their experience in these areas. So it really can be used for multiple purposes. It can be certainly an engagement tool as well as an assessment tool. So we want to look at prioritized goals from the assessment. Because at the end of it, the objective is from this assessment process, we want to be able to discern some identified goals that we can now begin to focus and put a lot of energy and resources into. So we want to make sure as we begin to pull from the assessment to inform a goal, we are looking at how does what we share and learn from that person really informs their hope, dreams, and aspirations. What are the needed skills and resources? So from that worksheet, we're able to identify what specific knowledge skills that person may actually need to meet their goals. The goals are supported by motivation from their valued life roles. How does that person, in identifying their valued life roles, see, based on their current circumstance, how do they see the services that they are actually engaging in helping them move more progressively or attain their valued life roles through this service? What strengths from the client's skills and resources in the area that you are trying to address? And remember, ultimately, the assessment is the basis for the individual service plan. From the assessment, we're trying to pull out, we're trying to decipher what knowledge, skills, and resources this person needs that actually informs their goals. And therefore, enables us to determine the appropriate interventions to address those goals. So the assessment process is really designed to inform the development of prioritized goals that reflects the individual's hopes, dreams, and aspirations. As we spoke to in the Vanessa scenario, simply looking at or hearing or discerning the person's challenges doesn't mean we can simply speculate on what prioritized goals are. That person has to inform what goals they prioritize. So this course, this worksheet has helped to really help determine what's the priority goals for this person. So we use that to really determine how do we help motivate that person? How do we help them identify their valued life roles in relations to this? And in what area they want to focus their energies and knowledge, skills, and resources on. So remember, we're talking about using the assessment processes, and in FCS is the comprehensive and uniform assessment, and potentially the wellness worksheet to help inform what are the person's prioritized goals based on their needs. And we know the assessment process is oftentimes a challenging one. I think people mentioned that before. It's not always an easy conversation. And oftentimes many clients don't want to share their goals for a number of reasons. They're tired of being asked, what goal do you want to work on? And discussing their goals or their idea of what they want to work on can be triggering. It can remind them of disappointments in the past when they identified a goal and they never achieved it. It sometimes can lead to anger about why am I in this situation that I have to rely on this person to get me to where I want to get. It may remind them of frustrations with trying and not achieving and some obstacles or sadness in general to just know that here is where they are in life. And they should be in a different place. So that's important to note. But ultimately, in as much as it is necessary and critical to the whole process of providing effective and appropriate service, intentional services, it is not easy. It's very challenging oftentimes to complete a good and comprehensive assessment. So we have to understand what potential obstacles lie in the way of getting as much information and accurate information to inform that goal development. Or to Carl's point, the person may be uncertain about what they need to already know. Yes. And there may be some concerns about, I'm at this point in my life, I should know this, I should have this. So it's about also acknowledging the person's right to be frustrated. These are the inherent challenges, and there's lots more challenges that you probably can share But we have to be aware that there are challenges to the assessment process. So we have to be patient, we have to be tolerant, we have to be compassionate, and we have to build as much trust and rapport as possible. And Kedron says, how do we respond when these are expressed to us? If these particular challenges are expressed to us, I think the first thing to do, and what is recommended, is to acknowledge it's okay. Listen, I can understand that you may not want to share your goals with me or share your aspirations with me because you may have gone through this a million times. So the first thing is to acknowledge the person's overture, acknowledge their specific communication with you. And once that acknowledgement is had, then say, I understand that you chose to access this service or you were recommended to access this service. What do you think this particular service engagement can do for you in general, in any dimensions of your life? How does this contribute to your wellness? How can we potentially help you to get to a better place that you need to be? Validate and continue to build trust. Service is all about the relationship. Someone will only seek to engage with you and to actually disclose their most intimate information about their life with you if they trust you and they feel that you're not just looking at them as a problem, but looking at them as an individual who, like everyone else in the world, has strengths, knowledge, resources, and needs. That's where it starts. And there's no perfect way. Everyone has their, particular challenge. So you may not get the response you need, or you may be able to acknowledge that, hey, maybe we'll try another time when you're in a better place or more ready to do this. So from identified goals to the knowledge, skills, and resource, we do the comprehensive assessment, which leads to the identification of value life roles, needs, and strengths. We use a knowledge, skills, and resource assessment. Really focus on how do we help the person identify their current knowledge, skills, and resource, and how do we move to what knowledge, skills, and resource they may need to address their particular concerns or address their needs. And then that develops, we establish a service plan that reflects those strengths and those needs, aligned with specific interventions that are person-centered and dedicated to addressing those concerns. We need to meet people where they are, to Anna's point. So this is the trajectory. We start with a comprehensive assessment. We look at knowledge, skills, and resources that the person has, strengths. We try to get a sense of the person's aspirations, goals, and needs. And then we inform a plan. We create a concrete, tangible plan to help that person address those needs, given the knowledge, skills, and resources they have and the knowledge, skills, and resource they need. So it's a really clear and definitive path. We don't go from looking at simply the referral package to writing a service plan. We need to engage in that discourse, that rapport building, that therapeutic alliance, and then we use the information from the assessment to inform the goals that we develop. So I know we've thrown a lot at you today, but I really am appreciative of your engagement and responses and understanding and sharing with us some of the challenges and successes you have in the whole assessment process, and the fact that it should really inform the development of goals, because the next session will move towards the development of goals and really informing and developing that individualized service plan. So I want to take this opportunity to ask if you have a minute or so to provide some feedback on the evaluation. It often helps us in really ensuring that the training is designed and shaped in a way that best inform your day-to-day practice and helps to really inform how you do things in a psych rehabilitation aligned approach with the underlying information that really helps inform your processes. And thank you, Karen. I hope it was as informative and really helps in our process. Upcoming session is next Thursday, same time. We're going to be focused on the golden thread of FCS number 3, which is individualized plan, components, and goal development. How do we develop a plan that really informs our engagement and interventions with our consumers? We want to also ask you once again to engage in a learning application. During the course of this week, we want you to try using the wellness worksheet with a client or a participant. And after reflecting, we'd like you to give some feedback on what did you learn using the form, and do you have any questions or concerns? We certainly like to get some feedback as to how it worked out for you. Emily put the wellness worksheet in the chat. So for those who may not be familiar with it, don't have it, you can use that in terms of your engagement with your consumer. Once again, you can use it as an engagement tool for new consumers, or you certainly can use it with one that you're in the process of assessing. So, in wrapping up, I want to thank you all. We appreciate your time and attention and participation. And today's webinar was hosted by DBHR through the Washington Healthcare Authority. We would like to remind you once again that the slides and a link to the recording of this session and a wealth of other resources will be available to you in a follow-up email. Don't forget to check out all things foundational community supports via the newsletter and upcoming training events. And if you have if you want more information on becoming an FCS provider, please reach out to WellPoint at the number listed below. I want to thank you sincerely for your usual active engagement, and we hope that you enjoyed and learned a lot from session 1 and 2, and look forward to the information for session 3. Erica, the emails should be forthcoming soon. Take care, Annette. And let us know if you, same to you. Let us know if you weren't able to get the follow-up information. But thank you all. Enjoy the rest of your day. It was a blast, and look forward to seeing you next week for FCS number 3.
Hi all. Just a quick note. In the past, I think Washington, so I just want to be clear, we don't send out the recordings, Washington State does. And I think in the past, they've waited until the series has ended in order to send out all the recordings. So if they didn't send one out for last week, I'm going to assume that they're probably doing the same thing. So once the 6th session has completed, then you guys will probably receive the links to all the sessions as well as all the PowerPoints from the trainings and all the materials. And Erica, you bring up a really good point. I know that they usually put everything on their YouTube channel. So it could potentially also be on their YouTube channel. It looks like that's what Erica's saying as well. She had reached out. So
yeah, and that may be the case, but certainly reach out to folks at DBHR, and they will inform you as to what's the timeline for sharing. But to Emily's point, we don't directly provide it to you, but you should be getting that email from DBHR. So thank you all. Have a good rest of the day. Take good care.